You are so beautiful. To me.
The Mercy Outreach Surgical Teams, or MOST, M-O-S-T as we abbreviate it, was started at Mercy Hospital 20 years ago. The first time I went on a trip with the team to Mexico, I remember getting off the bus when we arrived at the hospital. And we were faced with a sea of people, really, mothers and fathers and children who had come to see us, and they were probably 500 or 600 people. The biggest problem is that we know we can't really help every single one of them. We have to tell some patients, I'm sorry, we can't operate on you this time. And some of these patients do come from far away. I've had patients tell me they've walked for 3 days to get to see us, which is heartbreaking. So we do see every single patient. We make sure that at least we talk to each patient who's there to see us, and we have to sometimes tell them that we just can't help them at that point, and that's really hard. My wife Sally has been going with us for the last 5 years or so, since she's become quite interested in photography. Initially, she started out just doing the identification photos. We have a photo of each child on the chart when we see them in the clinic, and then when they're in the operating room, we use the photos just to identify them. Because oftentimes, she's been asked by the family if they can have a photograph of their child, because many of these families are poor. They've never had a photograph taken of their child, and so she'll obviously take an extra photograph and give them a copy just for their, for themselves, both before surgery and also after surgery. The reaction of the children to coming in and having surgery is probably similar to how kids react around the world. They're fearful when they have to leave their mom to come into the operating room, and some of them are crying, and some of them are just clearly anxious. Usually when they get into the operating room and are ready for the anesthesia, they figure out something's going on here and they get a little anxious. But our anesthesiologists are great. They just give them a little flavored oxygen to breathe and play a game with them, actually, and then they breathe through the mask and then they're asleep. The anesthesia is so quick that they don't really have time to be really anxious too long. And it's quite surprising to see how healthy they are and how happy they seem to be even the day after surgery. Most of them do go home because they're healing fine. Many of the children are out playing and seem as if nothing has happened. All the years that I've been doing this, there have been many patients that have been remarkable. And I do recall one time that was very touching a few years ago. We were doing our preoperative screening on the first day that we got there, and there were hundreds of patients, and this elderly woman came and sat down. It turned out she was 80 years old, and she had a very wide cleft lip. And so obviously she'd spent her entire life with a great big space in the middle of her face. And we asked her why she hadn't had this repaired before, and it turned out that she just didn't have the opportunity, but she made the effort to come and see us on this particular trip because she felt she was getting old, and she told us that as she was starting to think that maybe someday soon she was going to die. And she felt that she wanted to get her lip fixed and look good before she died, so that when she went to heaven she would look good and presentable. So obviously we all cried. Well, I feel blessed that I've been able to participate in this program. It gives me a personal sense of achievement. It allows me to use some of what I've learned to make a huge difference in people's lives. I realize that what we do in, say, an hour to, say, repair a cleft lip affects the child dramatically, because these children are often ostracized. So it's a life-changing endeavor by the team, and again, it's relatively simple for us to do this, and it's just sort of an amazing process where we can just do something fairly simple and make such a huge difference in people's lives.
You so